Dr. Konversasyon et pareil, moi dit de Topik Konversasyon de mardi, nous traite la santé et aujourd'hui nous parlons un coup, nous ban petit dimoun, ban petit dimoun, ça veut dire nous ban enfants et aujourd'hui bon matin nous causons avec un pédiatre. Aujourd'hui bon matin, il appelle Dr. Esther Bossy qui nous a dit aujourd'hui bon matin qui nous pourra adresser un petit peu le problème qu'il y a depuis les consulter les enfants qui quoi qu'il peut voir quoi qu'il peut commun aujourd'hui bon matin nous causons un petit peu là un petit peu de tout alors cela bon matin si on a une question ou capable envoyer le D88 89 soit en créole soit en anglais bien sûr et docteur il va capable répondre aux questions pertinentes ou s'assiser qui nous peut cause Lola. Docteur Eva, bonjour.
Morning.
Comment ça va?
Bien, merci.
Cause créole?
Chicken.
Chicken. So what words in Creole do you know? Don't tell me bad words.
No, I will not. But definitely I know.
You know. But you know when it's a bad word.
Yeah, I know.
So is that what I taught you only? So, doctor, how long you've been in Seychelles?
So now for my second time, because I've been here before, this second time already 6 years.
Already
but
6 years.
the first time, 2.5 years, from 2006 until 2008. Now I come back in 2018 until now.
Until now. Juste pour faire un rappel de la cour, Dr. Eva, il déjà travaille avec le ministère de la Santé auparavant, pareil, il s'y pédie et après il est allé, après il tourne encore et là, présent il peut travailler comme un pédiatre privé, bien sûr. Alors, pour aucune consultation capable de en contact avec Dr. Eva, bien sûr, nous pour cause le bonne maladie, comment il peut voir, il peut consulter bonnes enfants. Let's talk about the common diseases. You've been consulting all the children for how long now?
In Seychelles? You're talking about Seychelles?
Yes.
For 6 years, I've been as a pediatrician here.
So what have you discovered in the children?
We have a very common disease here, for example, now it's almost the same private administrative field, the same diseases you can see every day. Very common is a respiratory disease, especially infections. Can be upper respiratory infection or lower respiratory. Upper respiratory infection like a flu, the common cold, otitis, adenoiditis, tonsillitis. Less common, the lower respiratory infection like a bronchiolitis, bronchopneumonia, or pneumonia.
What have you observed from the common ones? Let's say otitis media. What have you observed?
It's quite frequent, especially for infants less than 1 year. Because as soon as they have a blocked nose or runny nose, everything in there is connected. So for the people to understand, the phlegms stuck in there and block the ears also, and it's very easy for the infant to get otitis media.
Otitis media, and some people said maybe when they go to the swimming pool, it can be
a
factor.
Yeah, one of the factors also, yeah.
So dans la cour, ça veut dire les temps où otitis media, ça veut dire nous peut cause maladie aux oreilles, bien sûr, les temps où permet nos enfants swimming pool. Parfois nous dit chlorine peut-être il fait les enfants malades aux oreilles un petit peu. Là docteur il confirme, il capable oui, il capable venir un facteur. Ben les autres maladies aussi qui nous peut aborder, maladies respiratoires et aussi nous peut causer un petit peu les autres quelque chose qui peut affecter de bons enfants, pareil asthma. Asthma aussi is one factor.
Yeah, asthma is very common here. As a chronic allergy disease, so we can see a lot in Seychelles. It's a chronic disease, chronic genetic allergy disease. Chronic because never cure. Even the people say, I was asthmatic when I was small. No, asthma is always there.
It's always there?
Yeah, you can be okay for even 10 years, but any time it will come back because it's a chronic disease. Allergy because there are so many triggers, especially the tropical time like here, is very common asthma. And genetic because it's coming from the family. If someone of the parent or any member of the family is asthmatic, definitely the child will have it.
Voilà, de la ou qui peut écouter nous là bon matin, nous peut cause bonne maladie qui est un petit peu plus commun ici, c'est celle, nous peut tous un petit peu de tout qui docteur est capable d'observer bonne le temps tous les jours qui peut faire son clinique, bonne qui est un petit peu plus commun, alors ou qui peut à la clinique pour un petit peu plus quelque chose, sinon prévention aussi est capable. What is the prevention?
For asthma?
Yes. Let's do asthma, then we'll go to otitis, and we'll go to the respiratory.
For asthma, to prevent, just to prevent the asthma attack, because asthma, definitely, it will come if you have a genetic, okay, someone in the family is asthmatic, definitely you will be asthmatic. But to prevent asthma attack, you have to avoid the triggers. There are so many of them, like dust, humidity, fungal inside the house, dogs, the hair from the dogs. There are some food also. They are triggers for asthma. And there is some books say that it's not good to give the baby when they start eating very early the citric, like orange or lemon.
Citric juice.
Yes. As soon as you know that the family, there is someone as asthmatic, you must try to give all of this as soon as later you can, maybe in 1 year old.
Is this clinically proven?
Clinically?
Proven.
Proven?
Yes. Is it clinically proven, citric juices?
Yeah.
It's clinically proven?
Yeah.
So it's a confirmation that you don't give it?
When you know that you're asthmatic, there are some, they are okay with the citric, there are some no, but I'm talking about when they start eating, when they are less than 1 year, when they start eating. It's better to try to give the citric as late as you can, because if you have already in the family history of asthma, definitely the child will be allergic or asthmatic, because there are another presentation of allergy, like atopic dermatitis, very common here also. The people calling eczema, so yeah.
It's very common here in Seychelles.
Yeah, it's very common, yeah.
What about allergic cough? Most of the children nowadays, they are getting this kind of cough, like dry cough.
Yes, most of them is allergy and most of them is a normal cough, like a flu.
When can you say it's a normal cough or not?
It's a normal cough when you're coughing, and for after some few days, it will go.
But what if it's persistent?
If it's persistent for for example, when I'm interviewing the parents, say, but this cough, it's been there for 1 week, 2 weeks, the parents automatically say, no, he used to cough, he's coughing almost every month. So this one we can say, definitely this is allergic cough. It's very often.
Ok, voilà, nous pouvons causer un petit peu le bon quelque chose qui docteur a découvert. Nous pouvons tous bon petit dimoun, nous causons nous bons enfants qui de temps en temps ils développent une certaine qualité quelque chose par exemple, un rime, et là tout, les oreilles fait mal, un petit maladie respiratoire, tout ça là, nous pouvons causer là aujourd'hui bon matin avec docteur Eva Bossy, bien sûr qui dit il y a un pédiatre privé qui il trouvé que docteur Mouti là-bas si vous voulez gagner contact avec lui pour consulter aux enfants n'importe qui quelque chose abnormalité qui vous voit avec les enfants capables de gagner contact avec docteur Eva côté clinique docteur Mouti. And we are talking about respiratory diseases. Let's talk about respiratory diseases in the children. How severe can it be?
If you are not taking care of, for example, a flu, and the cough is there for a while, and you are not taking care of what to give or what to monitor, definitely, it can go for a really bacterial infection, like a pneumonia. Of course, there are some pneumonia, especially for babies less than 1 year, needed antibiotic IV, admission, some more treatment. But if you take care of the flu like a normal flu, sometimes I say to the parent, as simple as you can do it at home, like a normal saline, a lot of water, vitamin C, as simple as you can do it. Of course, the fluid will go in 7 days.
You talk about admission. How often do you get admission?
So now, as a private practice, I have seen quite few babies, not that too many, but like a newborn with jaundice, when they are jealous. Yellow, sorry. Yellow. Some baby with pneumonia, someone with asthma, that even with the treatment, the normal treatment for asthma, they are not getting better. Definitely, I have to send to a hospital for admission because he have to be under supervision for a nurse, for doctors over there.
But do you go and check on them, monitor on them after that, after the admission, or?
I used to call, but I'm calling them to ask, even the parents, they call me back also. We are keeping contact, and I'm talking to my colleagues at pediatric almost every day. There is no problem with this.
Voilà un petit peu, docteur, à dire qui peut arriver. Bien sûr, you've got messages from our viewers. Says, good morning, Carol. Good morning to yourself. It's good morning, my darling doctor. It's good to see you on Bonjour Cécile. This is from Mary from Pralin. I think you know her because Mary est Pralin et Dr. Eva in des affaires cliniques le Pralin, in des affaires cliniques la Digo aussi, le tout le des îles et puis là il basé ici. More questions from our viewers, Dr. Eva. Can the Victoria Hospital have allergic tests available to facilitate your diagnosis?
At Victoria Hospital, no.
No.
But there are some private clinics, they can do it.
Private hospital can do it?
Private clinic, yeah. Like I think Pan-African, Euromedical, I think. I'm not so sure, but hospital, no. Victoria Hospital, no, that I know until now, no.
What are some of the difficulties doctors face when treating children?
Difficulties?
Yes.
To treat the children?
Yes. Difficulties you face when you are treating children.
Sometimes it's a joke, this, eh? It's more difficult to treat the grandmothers
than the children.
So, no, for me, no. Our room, for example, now at multi-clinic is very comfortable.
Yes.
We have a lot of toys, cartoon, pictures, stickers. They come in, and after, when I finish examining there, they don't want to go.
Really?
Because they are playing. Most of them, they cry. They don't want to go.
They don't want to go. What about when you have to do an injection?
I play with them. Around 2 weeks ago,
They're very sensitive, eh?
I got a little girl, 3 years old. She just put the arm like this. I say, I'm not going to cry, Dr. Ivan. I say, yes, I know you will not. And definitely she will not. She didn't cry.
Really? Voilà un petit peu l'expérience, docteur, pour une question qui vous peut envoyer, vous pouvez gagner la réponse. Steroid is used to treat asthmatic children. What are some of the long-term side effects?
The treatment for asthma?
Yes, steroid, eh?
Steroid, yes. Normally we use Budecor. It's a small dose before to sleep at night. Only 1 dose before to sleep. Some children, they have to use it for 1 year, for 2 years, depends. As soon as they are free of symptoms, for 2 years, we can stop it. But it's a small dose. We haven't get really side effect. Very rare, like some children gaining weight. But very rare.
It's very rare.
Very rare, yes.
If should there be a side effects, what it's like?
Obese. This is one of the side effects, because it's a steroid.
Okay.
Yeah.
Okay. More question. Good day. What is the difference between asthma and bronchitis? Do adults get bronchitis or only in children?
Normally, we calling asthma or bronchiolitis when it's less than 1 year. Bronchiolitis is a viral infection, very similar to asthma.
But you can tell the difference.
Yeah, the difference is bronchiolitis, no bronchitis. Bronchiolitis is a
Bronchiolitis.
viral infection. More common less than 1 year. For example, a baby with 3 or 4 months coming to our practice with difficulty to breathe, wheezy, cough, dry cough. We cannot say at this time it's an asthmatic patient. We just diagnose bronchiolitis, no bronchitis, bronchiolitis. After 10 months, even 1 year, okay, after second episode of this, the family history, we can say this is asthma. Bronchitis, normally we are calling when it's a little infection, for example, yes, like more than 1 year also. There are some parents, they ask me this question. When he was small, they diagnosed him as a bronchitis. I say, but what is the clinical pictures? Say, no, wheezy, coughing, like sneezing. I say, this is asthma. Totally, 100% asthma. But sometimes they confuse in the term, but definitely.
It can be confusing.
Yeah, it can be confusing, but definitely it's asthma.
Voilà la réponse pour aux questions pour qui envoyé. Mon souhaitais docteur répondre aux questions. Is there a vaccine preventing asthma?
We don't have here, but I know. For example, in my country, we have a vaccine for asthmatic patients. Yeah, they're using for sometime like a 1 or 2 year. It's not totally cure, but it's helping a lot.
But it can help.
It can help, yeah.
It can be prevented as well.
Yeah, it can prevent it, yeah.
Voilà, encore la réponse pour les autres questions. Pour les autres qui peuvent demander, now that we have said that doctor have already visited Pralin and like big, this question is for you, doctor. Dr. Eva, which island you like best? Is it Mahé, Pralin, or La Digue?
I'm okay in my head, but they know that Pralin and La Digue, they have a special place in my heart.
Really?
Definitely, yes.
Which
yeah.
part on Pralin?
Pralin, I was working everywhere. Besantan Hospital, Gratans, but normally I stay in Gratans because our house is over there. Yeah.
But which part do you like the most on Pralin?
On Pralin?
Yes.
Gratans.
Gratans. And La Digue?
I've been only on the place of the hospital and some places like La Paz. I have a lot of friends on La Digue.
Have you been to the beaches as
yes,
well?
I've been on the
Soulage?
Yeah.
How is it?
Amazing. I love it.
Voilà la question qui ou demande côté docteur côté entre les trois îles principalement côté entre les trois. Voilà la réponse pour aux questions. What advice would you have for young doctors? Let's say young pediatrician. What advice would you give?
The first thing they have to love the practice. To be a pediatrician, you have to love children. You have to love what you do, and you have to be very patient. Because I already told you, we are not only treating the children, we are treating grandparents and parents. So it's like a family around the child. So we need to be very patient.
They say if you want to be a pediatrician, you have to be a good parent or a good mother or a good father. Is that true?
It is.
It is.
Yes, definitely it is.
How can you say that? Why would you say that?
I'm a mother. I'm a grandmother also.
yeah.
And I consider until now I'm a very good grandmother and a very good mother. When I was small, I was playing all the time. My mother said I'm going to be a doctor, I'm going to be a doctor.
Really?
And all the time I was saying I'm going to be a pediatrician. Even I was growing in a pediatric hospital.
You still live with that, pediatrician all the way?
All the way, yes. That's it.
And now look at you, you're a pediatrician.
Yeah.
Dreams come true.
Yes.
They said dreams come true. For you, it has come true. And doctor, apart from being a pediatrician at the clinic, what other services do you offer?
We have a lab service. Nowadays, we are promoting full package at the clinic, including the full blood count, blood grouping, CRP, urine, stool test, X-ray if it's necessary, ultrasound, dental check, and eye check. This is a full package we have now. We have also a new service from my side. It's a hotel and home visit from 5 p.m. until 9 p.m. We can go any house, they can call, they ask for us, we'll go to the house, we check, you know, especially newborn. Sometimes the parents, they don't want to go out because the weather is not
to the
yeah.
clinic.
So we can go, and already we have quite few they calling, and it's okay. They are
So
satisfied.
in other words, you're saying you can do it in after working hours.
Yes, after working hours, yes.
Voilà, monsieur, madame, mademoiselle, le docteur peut dire, après le travail qui est normal, après son clinique, il est capable de venir faire consultation from 5 to 9.
To 9 p.m.
Depuis 5 heures jusqu'à 9 heures du soir, soit au colis, ou à côté il était, soit ici capable de venir côté, n'importe quelle façon, à cause de nous comprenons parfois, petit baba, especially the newborns, il est difficile un petit peu pour l'attendre dans la clinique, alors ça, ou capable de donner un petit call, docteur, soit venir côté, after working hours, and your contacts? Your contacts?
2583-651.
Voilà, docteur, il donne contact, comme ça, vous êtes capable de gagner contact avec lui. Sinon, vous donne un petit call. Côté docteur Mouti là-bas, et vous êtes capable de faire un contact, comme ça, vous allez mettre un appointment. Docteur est capable de voir aux enfants. Bonjour, good morning to you. Do we have specialist pediatricians in Seychelles? Will you know that? Specialist pediatricians.
Another pediatrician?
Do we have in Seychelles?
Yes, Dr. Govinden. My respect for this man, definitely. For me, he's the father of pediatric here in Seychelles. He's working at the AMSA clinic now.
Yes, AMSA clinic.
Yeah, and we have Dr. Seth, Seychellois as well, working at Raya Polyclinic. I don't know the schedule, but I know. And there are some pediatricians at the hospital, Dr. Rose, Dr. Rijo.
Voilà, la réponse pour question pour nous demander si on a encore un spécialiste pédiatre. Oui, docteur, in nom de toi, Dr. Eva, what do you like to do in your free time because you work very hard, especially after working hours? Do you have free time?
Yes, I have. I have. Me, I love the sea.
Ah.
In my free time, sometimes I'm going to the beach, some party.
Cooking. Do you like cooking?
Yeah, I'm cooking Cuban food.
Cuban food?
Yes.
What about Seychelles dishes?
Already
Creole dishes.
Already. Chicken curry with coconut milk.
Really?
Ladop. Yeah, I'm very good in ladop.
Ladop?
I have a nice teacher. Teach me ladop, yes?
Really?
Really? Yes.
Voilà. Dr. Eva, il peut faire curry coco poule, ladop mix. Ladop mix or just banana?
I like with banana, to make it with banana and breadfruit.
Ah,
that's the
fruit
most.
à pain.
Yeah.
Fruit à pain.
Yes.
What about cocosem? Cocosem, non?
I haven't tried.
You haven't tried it? Voilà, docteur, il fait un petit peu, nous pouvons faire un petit peu d'action tout en même temps. Il fait un petit peu la cuisine créole, hein, l'adobe, curry coco poule. What about poisson grillé?
Yeah, I can do it, but I left this for my husband. He's the best.
He's the best because he's a fisherman?
He's a skipper.
He's a skipper.
But he likes fish, fisherman, like a fisherman, but he likes cooking also. We have a deal.
You have a roster?
Weekend, mostly Sunday, one Sunday is Cuban food, one Sunday is Creole food. When he's at home, he's the one cooking Creole food.
Well, give me some Cuban food that you cook here in Seychelles.
Rice with beans, we call it congri.
Congri.
Rice with beans, black beans.
Black beans.
Yeah.
Ah.
All the Seychellois, when they try, they love it.
Really?
It's very tasty.
I haven't tried it yet.
Okay, I will invite you, definitely.
I will come, definitely.
Pork.
Yes.
We love pork. I have a friend always teasing me, he say, For Cuban, no pork, no party.
No party, no pork. This is true. 100% true, huh?
Yeah.
For Cuban, yes.
Yeah.
But I will definitely come for the rice and the black beans, so no worries, just give me a call.
Okay.
I'm gonna come.
For sure.
More questions. Okay. They're asking what is your Creole food. She already said it's curry coco poule souple. What do you miss most from Cuba?
I miss my country. Everything about Cuba, I miss it. My country is a lovely country. I love Cuba a lot, definitely.
But you do go there sometimes
yes,
for holiday.
Yes, yes.
For
definitely,
holiday.
yes.
Yes. And more questions coming in. Good morning, Dr. Eva. So happy to see you on Bonjour Cécile. It's been a long time. We worked together in SCBU. She was a good friend and a good doctor. SCBU must be at the Ministry of Health?
Yes, at neonatal intensive care unit.
Okay, okay.
Yeah.
So one of your mates is saying that they are so happy to see you on Bonjour Cécile. Moi so happy to see her. We've been in contact since last week.
Yes.
Yes.
I miss them a lot.
Et voilà, pareil, nous t'y causer, nous t'y dit, Dr. Eva, basé sur clinique Dr. Mouti, bien sûr, nous peut cause le bonne maladie qui peut les commettre de bons enfants, que simplement, il y a un pédiatre qui peut consulter de bons enfants tous les jours, quoi qu'il peut voir, qu'il y a l'augmentation, bien sûr, et qui moyen nous capables de faire une prévention un petit peu là, bien sûr. And doctor, what would you say or recommendations for the parents who are coming with their children who are sick and the common diseases?
One of the recommendations, there are some parents take a little time to go to see the doctor. There are some that are coming quick, like one fever, already coming to a doctor. This is okay. It's up to the parents, but my first recommendation is not to wait at home when the child is sick, especially when they are less than 1 year. Because
Reports? Reports at times.
yes, simple fever can be a bacterial infection. Another recommendation is about accident at home.
Yes.
Yes, because it's not that common now, but before I have seen quite few. Just the electric plug.
Some choking hazard toys
Yes,
as well.
a small toys that they can put in their mouth. Some chemical substance, medicine not too close to them. This is, I think, one of the most important things. Also, when they are in the beach, parents have to be monitored.
Even the swimming pool.
Yes, swimming pool.
You have to be careful. You have to be very prudent.
Yeah.
Keep your eye always on your child.
Yes.
Because you never know
Yeah.
what could happen at the glance of a blink of an eye. You never know what could happen, especially in swimming pools and on the beaches, and as well in the house, like electrical devices, something like that. Yeah.
And sometimes also parents with a small baby, like a newborn, 1 month, they try to sleep with them in the same bed. This is very dangerous.
Can roll over them.
Yes, and the baby can die because of asphyxia. Have to be careful. This is one of the things that we are always telling the parent to be careful.
Why do you think the mothers, the parents, do that?
This is like overprotection.
Is it bonding? Is it the bonding or overprotected?
Overprotected. They feel. I think they're feeling like they are closer. It's better. They can feel anything closer. This is my opinion. I think it's overprotection. Yeah.
It's overprotection. They need to feel the warmth. They say that the baby need to feel the warmth of the
from
body
the mother.
from the mother. Can you confirm that? Or to smell the breast milk?
Yes.
Or to smell the breast milk, they sleep more better?
And I was reading because I have someone close that used to do that. And I was reading that the child, when the child sleeps with the mother or father, the parents, they're feeling more confident. Right. The parents and the child also.
Yes.
It can be because,
I think it's trust as well, no?
Yeah.
And the breast milk, the breast milk, they will sleep better. Is that
Yes,
true as well?
yes. And this is one of the recommendations also I want to say here. Breast milk is the best, at least for 6 months. There are so many parents, they coming looking for a formula, this formula, that formula. Sorry about, because I know formula, they selling formula, but breast milk is the best.
It's the best
It's
one.
the best. I said to one mother, she came to me yesterday. Try, you will see. She was with me for more than 15 minutes. I tried to teach her how to do it. Be patient, relax, it will be okay. The baby went out already feeding. But you have to be patient, you have to focus in it, you have to relax.
When you're a
I
mother,
say,
you have to.
we are the only one looking for another milk. You will not see the dog giving cow milk. You will not see the cat looking for another milk. We
It's
are
true.
the only one.
Looking for other alternatives.
And this is the natural one. This is the one given to us to give to our children.
And it's for free.
Yes. And
You
you don't have to
buy
warm
it.
it. You don't have to warm it. You don't have to put in any place. You will avoid a lot of things. And everything is there.
Just
All, yeah.
put it in the
All
mouth.
the baby need is there.
And it's for free. Par docteur peut expliquer, dit le tété is the best one instead of while de la boutique ou pour acheter sa bonne dire bonne formula. Bien si ça en dit le tété it's for free, hein. Pas besoin de dépenser l'argent. One question from our viewers. Hi Carol, hi yourself. Please ask her if I want a consultation and an overall test for my son. How much does she will charge?
The full packet.
Overall test, a consultation and overall test for his son.
Yes, this is the package we are talking about. It's 1,500.
1,500.
Yeah,
1500
yeah.
roupies, ça veut dire. You
Yeah.
understand 1500 roupies?
Yeah.
1500 roupies, il pour arriver. And that will, for how long is that?
No, we are doing every time.
Every
time.
1500 roupies
Full
pour
test,
question.
urine, stool, ultrasound, everything.
Voilà, un petit peu de sa full test qu'il y en a. And what are your prices like?
It's not that expensive.
Not that expensive?
No, and I have to say, Dr. Muti is a flexible
Very
person.
flexible.
Even there are some parents, they come and they say, no, I don't afford to do this. We talk to him, but it's okay.
For a normal checkup,
Normal checkup is 400 rupees.
400. For a normal checkup, it's 400
Consultation,
rupees.
yeah,
It's included the consultation.
yeah, yeah,
The consultation included in the 400.
yeah.
Un normal check-up, 400 roupies, et une consultation, il inclut là-dedans. Pareil, aucune demande pour un overall test inclus sur consultation, il arrive 1500 roupies, mais au bénéficiaire que dans sa overall test, you get ultrasound. What do you get in the overall test?
Ultrasound, urine, a stool, flu blood count, blood grouping, CRP is something, blood test like will tell you if you have any inflammation or infection. Eye check and dental check.
Plus consultation.
Yeah.
Voilà, qui nomme de 1500 roupies, qui vous pouvez gagner si vous avez envie, on met nos enfants pour faire un full overall test, pareil, on dit, voilà, qui inclut là-dedans, on va gagner contact avec Dr. Eva. Sinon, un normal check-up, 400 roupies, inclut ou consultation, mais par contre, pour les autres services, the price will vary from other services.
Yeah.
Yes. Et mon peu en même temps, la cause docteur, il dit, comme ça, il comprend créole. So, moi, il paie pour répondre à créole. So, moi, il comprend tout quelque chose qu'il nous dit. Si, il paie pour répondre à créole. Docteur, before we conclude, anything you would want to add regarding what you have observed in the children?
About my practice here, we already talked about the precaution that the parents have to monitor it, and they are lovely children. Saicheloa, they are lovely children. Definitely they are. I'm very surprised. Sometimes coming to my clinic like sad for something else, and definitely they make my day.
It's just sad when they are sick.
Yeah.
Yes.
But they are lovely. They are lovely children.
Lovely children, gifted, but only when they are sick, it's just sad and sensitive.
Yeah, yes.
They
very,
cry and
very,
everything.
very,
Yes.
very.
And the parents get emotional as well when
definitely.
their sons or daughters are sick. Yes. Voilà, Cécile, nous avons causé avec Dr. Eva Bossy, pediatrician, côté Dr. Mouti, bien sûr, nous avons causé un petit peu le bonne maladie qui lit, il consulte tous les jours, qui voit les bonnes enfants, ben qui un petit peu plus commun, qui nous peut faire prévention aussi, et ben qui laisse quand même, mais seulement il a, et Dr. Eva, bien sûr, il trouve côté Dr. Mouti. Dr. Eva, merci beaucoup pour faire le temps, pour venir nous donner la bon matin. Et bien sûr, moi, les autres parents, ils vont consulter ou, ben qui demande question, peut-être un petit peu quelque chose, et très bientôt, on est capable de gagner 10 moun.
My pleasure. Thank you for the invitation.
It's an absolute pleasure. Mon content de à nous, docteur. Et passez bonne journée aujourd'hui. Pas de clinique même, hein?
I'm going to work now, yes.
You're going to work? OK. Passez bonne journée aujourd'hui, docteur. Bon courage avec bon petit moun.
Pardon?
Bon courage with those little ones.
I don't understand.
With your children, with the little patients.
Pardon again?
I said good luck.
Oh, with my children.
With your children,
yes.
all the little patients.
Yeah.
And everything else that you do.
Thank you.
Thank you so much. C'est le type de chose avec bien sûr pédiatre privé qui trouvait basé dans la clinique Dr. Mouti, bien sûr qui il traite consulter bonnes enfants et bonnes maladies qui y voit comment on capable de dire ça. Dans un petit call que Dr. Mouti là, mais c'est parce que Dr. Mouti on capable mettre rendez-vous pour voir Dr. Eva ou même les autres services qui il nomme qui les autres fait. Pas oublier Dr. Eva, il fait aussi ben after work services à Bessie 5h jusqu'à 9h, il est capable de venir ou soit ou venir pour consulter aux enfants. C'est tout bon enfants qui fait que les newborn Paris nous dit qu'il y a un petit peu de difficulté pendant la journée pour arriver à la clinique ou capable de après 5h. On va faire ça dialogue et comme ça on va voir what's the best way vous êtes capable d'aider les enfants pour les continuer à vivre. It was an absolute pleasure, doctor. Thank you so much. Et Cécile. Same. Et Cécile, ça c'est une Topik conversation pour la bon matin.